We all have anxiety from time to time, but how do you know if it's something that should be treated with a medical intervention? Joining us today is Andrea Razavi, a licensed professional counselor from the Behavioral Health Service in Mayfield Village. And Andrea is here with some tips to help us to learn how to relax a little bit in life. Welcome to the program, Andrea.
Thank you.
So, when someone says they're anxious, I think of a feeling of just like uneasiness. But how do mental health professionals define anxiety?
Well, oftentimes, Karen, we have physicians refer clients to us when they find out that they're having all kinds of symptoms, racing heart, headaches, other symptoms of stress in their body, gastrointestinal distress, and after they find out that there's really nothing medically or physically wrong, they'll refer it to a mental health specialist to deal with what's going on inside. Why is this happening? So there's a huge spectrum of anxiety disorders, anywhere from phobias, agoraphobia, social anxiety, to OCD, and general anxiety disorder.
Well, what's going on in the body when someone maybe has, I think it's very common for people to feel sometimes that chronic anxiety, anxiousness. Is it how we talk to ourselves that's causing this, or is there actually some biochemical reasons we feel anxious, or both?
That's a great question. It's actually a combination of several of those all at one time. It can be a predisposition that you have. First of all, genetic, and we know anxiety is so hereditary. It really is. And there's generations that can pass on that anxiety. So there are things that are happening when you're feeling anxiety, and the mind, the brain, the way it tends to ruminate and worry and continue this negative stress loop is really the biggest enemy. So there are several things going on in combination, and what you're exposed to in life and your environment has a lot to do with how well you either are able to cope with that stress and anxiety physically, emotionally, mentally, spiritually, or not cope. And that's why counselors are there to help that make a difference.
So as a counselor, if I came to you and I was just feeling a lot of anxiousness, what would you recommend? What things can we do to kind of ease that?
Well, first I'd make sure I do a really thorough assessment. We're really big on that in our profession because there's so many different forms of anxiety, and there are a lot of different solutions. So you don't want to give the wrong treatment for the wrong type of anxiety. And sometimes it takes a couple times to find out where it's coming from. So first of all, I would take a good history of your lifestyle, your sleep habits. Sometimes we find out that people aren't sleeping, and that can just take anxiety off the charts. Often diet is affected by anxiety. Often something that happened, a recent trauma or stressor that they didn't even think was going to bother them, can bring on anxiety. Loss or a situation that happened that they just sort of brush off and think they can handle it. So there are different types of things that I would assess. And then we go from there, finding out what exactly it is. Some anxiety is more difficult to treat than others and takes a longer course of action. But keeping a log, how you're feeling, what the stressors are, when they occur, and maybe what the triggers are. People don't really know what a trigger is. So I might say, Karen, I want you to come back to the next session keeping a diary of when you feel that tension in your stomach, or you're feeling anxiety. Is it evening? Is it morning when you wake up? Is it when you go to the office, when you're driving to work? Is it when your spouse or significant other comes home? Are you on edge? Things like that.
So it might be as simple as eliminating a job or a spouse.
Sure.
I hate to say that, but maybe.
Really, lifestyle situations people don't realize, and that's a huge part of it. People don't realize that they do have choices, and they can make better choices, but sometimes it takes an unbiased person to go see and talk to and say, have you thought about rearranging your life? We don't encourage, anything as relationally, but maybe couples counseling may help too.
Why does counseling seem to work when we come and talk it out? How does that relieve anxiety or stress?
It's amazing, Karen, how just when people walk through that door and sit down, and when they feel a rapport with the counselor, which is the most important connection you can have when you come to counseling with the whole process, people all of a sudden feel this relief that I shared this with somebody, or I'm talking about it, or it's out of the closet. There's a lot of shame involved with having the anxiety off. People hide it. They don't want to talk about it. Social phobia, social anxiety is a big fear. Fear of needles, fear of animals, fear of heights, fear of flying or travel. And once they talk about it, it's the first step. and they
Do
feel
you think
better.
we're seeing more anxiety? Because you hear on the news a lot of times with celebrities that were taking these drugs that, with other things, and they passed away. They were
Right.
taking drugs for anxiety because we're so connected, but we're not. We're on Facebook, we're texting, and you mentioned in counseling, you come to counseling and you get that physical, immediate connection with another human being.
Yes, we are. Our society right now has it's unbelievable what's happening now. There's too much going on now in the world. Everybody is disconnected because of all the social media, and then there's this pressure to produce, and we're in this quick instant society where people don't learn to meditate and relax and enhance their spirituality. So it's a very tough time in the world, and we see children I see children, I see adolescents, I see adults. We're seeing all ages come, and we're finding out that the sooner we address anxiety in young children, the better the outcome, because it is often genetic. So we see children coming in with all kinds of issues, and we can help them cope better so that when they get to adulthood, they have better mechanisms to deal with all that stress or anxiety.
Are there any homework assignments you give to your patients to do outside, like yoga or some sort of getting a massage? Is anything like that?
Well, I do a lot of CBT. We know there's a few things that are very...
and CBT?
The cognitive behavioral therapy. So like the list that I mentioned, I'll ask somebody to give a list of how you're feeling, when you're feeling, and then we'll come back and we'll sort of deconstruct their belief about those situations. So we're kind of changing the thought process and also stopping that negative rumination and that cycle of stress of thinking and worrying and rumination. So I will teach them to do that. So there is homework involved with that, and sometimes exploring yoga, exploring something relaxing, nature. I encourage people to get out in nature, and I'll say, keep a log. Did you go take a walk in the park today? And I'll always get a physical, because sometimes there are high blood pressure can cause anxiety, diseases that cause vertigo that can cause increasing anxiety. Saying take care of yourself, and also sleep. Keep a diary of your sleep habits. Are you waking up? Are you not falling asleep on a regular basis at a good time? So a lot of diaries, CBT, exercise, hygiene.
I know in your profession you do not personally prescribe medication, but do you ever recommend any of your clients to go to a psychiatrist or their family doctor for medication?
Sure, but it's part of the assessment. I sometimes will ask people how they feel, if they've been in therapy before, if they've ever been on medication, and how has it worked for them. Some people are very opposed to medication. So sometimes after seeing them for a while, if they're not getting better, sometimes I'll recommend, would you consider being referred to a psychiatrist? And of course we have a psychiatrist there on staff. We have a huge list of people that we can refer to. And it's up to them, again, if they want to take medication. And there are a lot of good medications out today that do help. Anxiolytics, combination medications for a little depression, mild depression, and anxiety. So I would sort of my call ethically to ask if they'd like to be referred, and sort of a judgment call. But yes, some people have severe anxiety and panic attacks that sometimes medication really helps.
And they may be self-medicating themselves at home, which could probably lead to other problems.
Absolutely. If a lot of people, we find alcoholism, drug abuse, drug dependency is a result of unchecked anxiety. People are self-medicating in order to deal with their anxiety rather than doing CBT, seeing a counselor, perhaps going on some type of appropriate medication.
Well, there is a lot of help out there. How can people reach you if they would like more information?
Sure, they can reach us. Our phone number is 440-460-0140. And we also have a website, Family Behavioral Health Services, LLC, on the website. And
in Mayfield Village.
Mayfield Village at the Jefferson Park Complex, right off of Wilson Mills Road. And I-90 is right there, 480 West is right there. So yeah, have them give us a call, and be happy to see and help them with their anxiety.
Well, I feel more relaxed just talking to you.
Thank you.
All right, thank you. We'll be right back with more Mind, Body, and Spirit.